Hi, good morning. This is the follow-up of the patient with diabetes type 2 and Parkinsonism. So he brought me the blood test, which he did in India, and I noticed the main point is that his fasting blood sugar is 165 milligram per deciliter, and this is very high, and his hemoglobin A1C is 7.4. It is also very high because the normal fasting blood sugar should be less than 90, between 70 and 90 milligram per deciliter, and the hemoglobin A1C less than 4.5%. Okay, so also thyroid gland. They did not do free T3. T3 is the active thyroid hormone, which is made by T4. T4 is converted to T3, and also they should do reverse T3. This is what I advise him. So the advice is, I asked him what does he eat, because he told me he eat one meal. He said 1 avocado and 2 boiled egg, and this is good, and big salads. But I said, what is the eating window? He said from 1:30 p.m. to 6:30, which is 6 hours. I said, can you reduce it to 3 hours, 2 hours, or even 1 hour in your case? Because your diabetes, it was 32 years, so we need to work hard to reverse the disease. Number 2, you have to fix CGM, which is continuous glucose monitoring, and then you will learn how your body reacts to the food. I advise Libra 3 Plus. I have nothing to do with this company, but there is a friend in Germany now, he is using it, and it is cheap. It is 72 euro in Germany. He ordered it in the pharmacy, but here I went to Booth, they don't sell it unless I have a prescription from the GP. So I did have prescription, and then I will pay for it for myself. So let us use it because it is cheaper, because there is very advanced and it costs thousands. There is a lady doctor, she used that high standard. Okay, then he has to buy a machine to do his blood sugar and his ketone, because he should be in nutritional ketosis. And nutritional ketosis mean the 0.5 millimole per liter to 2 millimole per liter, to make sure, because ketone is anti-inflammatory and it is very good fuel for the body. It will reduce oxidative stress and reduce ROS, which is reactive oxygen species. Also, he has done ultrasound to his prostate, and it is bigger. So I told him this is normal. All patients with high blood sugar, they will have big prostate, and then if they continue, they will have cancer of the prostate, because high blood sugar, it causes inflammation, and also insulin hormone, if it is high, it also causes cell growth and proliferation, and also lead to even cancer. It is one of the contributing factor. Okay, insulin resistance. I advise him to do his fasting insulin level privately, because they don't do it in the NHS, and also to do the glucose tolerance test with insulin. That he go fasting, they take a blood sample to check the fasting blood sugar and fasting insulin level. We should be less than 6 micro unit per mil. And then they will take sample after half an hour, 1 hour, 2 hour, and even 3 hours to check the blood sugar and the insulin, because the idea is to know what is the spike of the blood sugar and what is the spike of insulin, and how many hours it will be reduced to normal. And if it continue more than 2 hours, 3 hours, or 4 hours, this means that he has insulin resistance. Of course, he is diabetic. About the Parkinsonism and the tremor, he doesn't have good sleep, so I advise him to take magnesium L-threonate, 500 milligram at bedtime, and perhaps even if he can take melatonin hormone 0.3 milligram, very low dose, which is the physiological dose. Okay, so this is the advice. And of course, he does exercises, and he has to do yoga. The idea is not to do too much, but sometimes not to do anything, because he doesn't believe in the yoga in the gym, because he said it is too simple. But we need to relax. The yoga is very good for relaxation, for stimulation of our parasympathetic nervous system, and this system, it will heal, our body will heal if we are in this state of relaxation. So we need relaxation like yoga, and it is not the difficult one. For example, the flow yoga, when you do sun salutation and down dog and quickly, it is good to do relaxation and meditation. It is very, very good for healing the inflammation and reducing the blood sugar. And I told him that the blood sugar is high not only because of the food, but sometimes because of the stress. And sometimes if we eat too much protein and fat, the liver will change it into glucose. Thank you. Subscribe to the channel and distribute the knowledge, and goodbye.